The emergency room thrives on speed, and in the relentless chaos of a level 1 trauma center, being slow is a cardinal sin. They called her Snail Sarah, laughing mercilessly behind her back. But when the hospital doors blew open and a military medevac touched down, the laughter stopped dead. St. Jude's Medical Center in downtown Chicago was a meat grinder. It was the kind of emergency room where seconds dictated the brutal line between life and death, and the staff operated on a toxic cocktail of adrenaline, caffeine, and ego. In this hyper-accelerated world, Nurse Sarah Jenkins was a glaring anomaly. At 54, Sarah didn't walk. She glided. She never ran down the halls, never raised her voice, and never seemed to break a sweat. Her greying hair was always pulled back into an immaculate, severely tight bun, and her uniform was pressed with a military crispness that her younger colleagues found almost comical. But her most defining trait, and the source of the department's endless mockery, was her speed, or rather her profound lack of it. Dr. Graham Harrison, the ER's 31-year-old hotshot attending physician, despised her. Harrison was brilliant, wealthy, and arrogant enough to believe he was the sole reason Street. Jude's mortality rate stayed below the national average. He moved like lightning, barking orders, snapping his fingers, and treating the nursing staff like an extension of his own medical instruments. "Jenkins, I need 2 milligrams of Ativan, push it now." "Move," Harrison shouted one Friday evening, his gloves covered in blood, as a seizure patient thrashed violently on the gurney in Trauma Bay 1. Sarah stepped up to the cart. She didn't scramble. She picked up the vial, held it up to the harsh, fluorescent light, checked the label, verified the expiration date, and then slowly drew it into the syringe. She then looked up at the monitor, her eyes scanning the patient's vitals, before turning to the patient's chart. "Jenkins, did you suddenly forget how to walk?" Harrison barked, his face flushing red. "Give the damn push," Dr. Sarah said, her voice a low, calm alto that barely carried over the alarms. The EMTs administered a heavy dose of midazolam en route. Her respiratory rate is already dropping to 8 breaths a minute. If I push this Ativan, she will stop breathing entirely. I suggest we wait and secure her airway first." Harrison froze. He darted his eyes to the chart the EMT had hurriedly tossed on the counter. He had missed it in his rush. A sharp silence fell over the bay, broken only by the rhythmic beeping of the heart monitor. Harrison snatched the laryngoscope from the tray. "Intubating," he muttered, refusing to acknowledge the mistake. Instead of gratitude, the incident only fueled Harrison's resentment. In the break room later that night, the mockery was loud and unforgiving. "I swear, watching her draw a syringe is like watching paint dry in slow motion." Jessica Miller, a 23-year-old nurse who mirrored Harrison's every move, laughed over her coffee. "I don't know why administration keeps her. She belongs in a suburban clinic, handing out lollipops, not a level 1 trauma unit. She's a liability," Harrison agreed, walking in and leaning against the doorframe. In trauma, hesitation kills. Snail Sarah is going to cost someone their life one of these days because she has to read the fine print on a saline bag. I've already filed 2 complaints with the director of nursing. We need her out. Sarah stood on the other side of the thin break room door, holding a fresh stack of trauma flow sheets. She heard every word. Her face didn't betray a single emotion. She simply turned and walked back to the supply closet. She was used to the isolation. Over the past 8 months, since she transferred to St. Jude's, she had become the ghost of the department. The other nurses wouldn't invite her to post-shift drinks. The doctors would actively bypass her, requesting Jessica or the other younger, faster nurses for critical codes. They left Sarah with the mundane tasks, charting, taking inventories, and dealing with stable, low-acuity patients. What they didn't understand was that Sarah's slowness wasn't a lack of urgency. It was an extreme economy of motion. Every step was calculated. Every pause was an assessment. In a room full of people running blindly into the dark, Sarah was the only one letting her eyes adjust. But in a culture that praised frantic movement as a sign of competence, her quiet precision was entirely misunderstood. She didn't try to explain herself. She didn't wave her resume in their faces or tell them about her past. She just clocked in, did her job with flawless, albeit methodical execution, and clocked out. Let them call her Snail Sarah. She had survived far worse than the bruised egos of civilian doctors. 3 weeks later, a massive unseasonal storm front violently collided with the warm air over the Great Lakes, wrapping Chicago in a suffocating grip of torrential rain and gale-force winds. The sky bruised into a sickly bruised purple by 2 p.m. Inside the ER, the atmosphere was tense. Rain lashed against the reinforced glass of the ambulance bay doors. At 3:14 p.m., the dispatch radio on the charge nurse's desk crackled to life, slicing through the low murmur of the department. St. Jude's, this is dispatch. Code yellow. I repeat, code yellow. We have a catastrophic structural failure and secondary explosion at the Hammond manufacturing plant in the industrial district. Multiple casualties. Burns, crush injuries, shrapnel. Be advised, local traffic is gridlocked. Expect a massive influx of walk-ins and ambulance arrivals in 5 mics. The ER erupted. Clear the bay's discharge anyone who can walk, Dr. Harrison, yelled, his voice cracking slightly with adrenaline. Jessica, get the burn kits. Page every available surgeon in the building. We need blood from the bank. All O negative right now. Within 10 minutes, hell walked through the sliding doors. The emergency room transformed into a battlefield. Men and women, covered in toxic black soot, and blood were wheeled in, screaming. The metallic smell of blood mixed sickeningly with the harsh chemical odor of burnt plastic. It was a mass casualty incident of a scale St. Jude's hadn't seen in a decade. Dr. Harrison was the senior attending on the floor, and the pressure immediately began to crush him. He was sprinting from bed to bed, shouting orders faster than the nurses could process them. I need a chest tube in Bay 2. Jessica, start a central line in Bay 3. Where is the damn portable X-ray? Harrison's voice was growing frantic. He was moving fast, but he was getting sloppy. He dropped a scalpel, cursed, and tore open a new one, breaking the sterile field in his haste. Amidst the screaming and the frantic running, Sarah Jenkins moved like a rock in a rushing river. She didn't run. She walked into Bay 4, where a factory worker was bleeding out from a severely lacerated femoral artery. Jessica was standing there, panicking hands, shaking so badly she couldn't tear open the trauma dressing. Move, Sarah said quietly. Sarah stepped in. Her hands moved with a terrifying mechanical grace. She didn't fumble. She applied a tourniquet, high and tight on the thigh, twisting the windlass until the bright red arterial spurting stopped instantly. She secured it, checked the time, and wrote it on the man's forehead with a Sharpie. She then established 2 large-bore IVs in his arms in less than 20 seconds, a feat of pure muscle memory that Jessica stared at in shock. He stabilized. Push fluids wide open, Sarah instructed Jessica calmly, before stepping away to the next dying patient. Across the room, Harrison was losing control. We don't have enough beds. Triage them in the hallway, he screamed. Suddenly the red emergency phone on the wall, the direct line for critical air medical transport, blared. The charge nurse snatched it up, listened for 5 seconds, and went pale. "Dr. Harrison!" she shouted over the din. "Life flight is grounded. The winds are gusting over 50 miles per hour. But there's a patient at the site," the plant manager. He took a steel I-beam to the chest. Tension, pneumothorax, failing vitals. The local ambulances can't get out of the industrial park because of a chemical fire blocking the roads. So he's dead. Harrison snapped his hands, covered in blood eyes, wild. If life flight is grounded, nobody is flying. "Not civilian," the charge nurse yelled back. The National Guard at the nearby airbase diverted a Black Hawk medevac. They just scooped him. They are inbound in 4 minutes. But Dr. Harrison, they're requesting an immediate hot offload on the roof. The pilot says he only has a 30-second window to hover before the wind shear forces him to abort and dump the patient at a suburban clinic that can't handle him. Harrison's face drained of color. A hot offload, extracting a critical patient while the helicopter's rotors are still spinning at full power, is incredibly dangerous under normal conditions. In 50-mile-per-hour winds on a slick rooftop, it was suicidal. Civilian doctors rarely, if ever, trained for it. I can't send my team up there in a gale-force storm," Harrison stammered, looking at the rain violently hammering the windows. His arrogance evaporated, replaced by raw, paralyzing fear. "I don't know the hand signals for military birds. If someone walks into the tail rotor in the dark, the radio patched through to the ER overhead speakers. The sound of deafening rotors and static filled the trauma center. St. Jude's ER. This is Dust-Off 7-2. A commanding, desperate voice roared through the static. It was the pilot, Captain David Reynolds. "I am fighting a 50-knot crosswind, and I am bingo on fuel. I have a patient coding in the back. I need a trauma team on that roof right now. Who knows how to approach a UH-60 in a storm? Or this man dies in the sky. Do you copy, Harrison?" Stood frozen, his jaw tight. Jessica backed away from the elevator doors, terrified. The entire ER seemed to hold its breath. They were going to let the man die. A hand reached out and unhooked the radio mic from the wall. "Dust-Off 7-2, this is St. Jude's," Sarah Jenkins said. Her voice was no longer the quiet, deferential tone of the ER outcast. It was a sharp, booming voice of absolute authority that cut through the chaos like a knife. "Go ahead, St. Jude's. Who am I speaking to? I need someone who knows what the hell they are doing," Captain Reynolds shouted over the radio. Sarah didn't hesitate. Captain Reynolds approached from the south to break the wind shear against the elevator housing. "Keep your pitch flat. We will approach at your 3 o'clock. Do not power down. Maintain your hover tension. We will extract in under 15 seconds. There was a pause on the radio, filled only with the sound of the storm and the thumping of the helicopter blades. Then the pilot's voice crackled back, but the panic was gone. It was replaced by a tone of stunned, profound respect. "Copy your instructions. Wait, I know that voice. Is that Commander Jenkins?" Every single head in the emergency room snapped toward Sarah. Harrison's jaw practically hit the floor. Jessica gasped. Sarah ignored them all, her eyes locked on the ceiling as if she could see the chopper through the concrete. "Less talking, Captain. Keep your bird steady," Sarah commanded. "I'm coming up." The emergency room plunged into an absolute, breathless silence. The steady wail of the wind outside and the frantic beeping of the cardiac monitors seemed to fade into white noise. Dr. Graham Harrison stood paralyzed, staring at the gray-haired 54-year-old nurse holding the radio microphone. Sarah Jenkins didn't look back at him. She dropped the radio receiver, her movements suddenly carrying a weight and purpose that completely shattered the snail Sarah illusion. She strode to the emergency disaster locker at the end of the hall. She didn't run, but her stride ate up the distance with military efficiency. She ripped open the locker, pulling out heavy-duty rain gear, industrial ear protection, and safety goggles. She threw a high-visibility harness over her scrubs and turned to the stunned medical staff. Harrison Sarah's voice cracked like a whip. "Put this on. You're coming with me." She threw a pair of goggles and earmuffs at his chest. Harrison fumbled, barely catching them. "Jenkins, I am not trained for a tactical air evacuation. It's a 50-mile-per-hour crosswind. We could be blown off the roof or into the tail rotor. You are the senior attending physician," Sarah said, her voice dropping to a terrifyingly calm register. "There is a man dying in the sky who requires a physician's sign-off for a blood transfusion upon transfer. You will step onto that roof, you will follow exactly 3 paces behind my right shoulder, and you will not deviate. If you panic, I will leave you on the tarmac. Am I understood?" Harrison, the arrogant prodigy who had mocked her for months, swallowed hard and nodded. He strapped the goggles over his head, his hands visibly shaking. Jessica Sarah pivoted to the young nurse. "Prep Trauma Bay 1. I want a massive transfusion protocol initiated. 4 units of O negative on the rapid infuser. Have the chest tube tray open and the betadine poured. We will be down in exactly 4 minutes." Sarah turned and badged into the restricted elevator, Harrison trailing behind her like a frightened child. As the doors closed, the sound of the ER was completely cut off, replaced by the mechanical hum of the elevator, ascending to the helipad. "Jenkins," Sarah Harrison stammered, staring at the floor indicator ticking upward. "Who are you? How do you know military flight protocols? Keep your mouth shut and breathe." "Doctor, you're hyperventilating," Sarah said, not looking at him. "When those doors open, the rotor wash combined with the storm is going to hit you with the force of a hurricane. Do not stand straight up. Keep your center of gravity low. Follow my hand signals." The elevator jolted to a halt at the roof access level. Sarah slammed the heavy steel emergency release bar. The door blew open, and the storm rushed in to greet them. The noise was an apocalyptic roar. The rain wasn't falling. It was flying sideways, stinging their exposed skin like buckshot. Hovering precariously just 10 feet above the slick-painted concrete of the helipad was a massive slate-grey UH-60 Black Hawk helicopter. The massive rotors whipped the rainwater into a blinding torrential fog. The aircraft was swaying violently, fighting the vicious crosswinds just to stay level. Sarah stepped out into the tempest. She didn't flinch. She dropped into a low tactical crouch and moved forward into the blinding rotor wash. Harrison followed, terrified, nearly slipping on the wet concrete. Sarah raised her right hand, forming a closed fist, then pointed 2 fingers toward her eyes and slashed them horizontally toward the cockpit. "I have visual. Approach on my mark." Inside the cockpit, Captain David Reynolds saw the lone figure in the high-visibility harness through his night vision goggles. Despite the raging storm, the figure's stance was perfect. Reynolds eased the collective down. The massive wheels of the Black Hawk slammed hard onto the concrete. The rotors continued to scream at full power, threatening to lift the bird right back off the roof. The side door of the helicopter slid open. A soaking wet military flight, medic specialist Cody Brooks was kneeling over a blood-soaked civilian on a standard NATO litter. Sarah moved in under the spinning blades, Harrison right behind her. As she reached the door, she looked down at the patient. It was Robert Davies, the plant manager. His face was a horrific shade of purple, his lips blue. He was violently gasping for air that wasn't reaching his lungs. Specialist Brooks looked up at Sarah, screaming over the deafening roar of the engine. Tension. Pneumothorax. His right lung collapsed 10 seconds ago. Trachea is severely deviated. If we move him into the elevator, the pressure will stop his heart before we hit the ground floor. Harrison leaned over his eyes, wide with panic. "We have to get him to the bay. I need a scalpel to insert a chest tube," he screamed back. Too slow, Sarah roared over the engine. She didn't hesitate. She didn't wait for Harrison's order. She reached into her thigh pocket and pulled out a long, 14-gauge decompression needle. Right there on the rain-lashed roof, deafened by the screaming engines of a military helicopter, Sarah moved with that same deliberate, methodical slowness that the ER had mocked her for. But here in the chaos, her slow movement revealed its true nature, absolute, unshakable precision. She didn't fumble with the patient's soaked shirt. She ripped it open. She didn't frantically search for landmarks. She calmly placed her fingers on Davies's collarbone, slid down to the second intercostal space, mid-clavicular line. "Hold him down," she ordered Brooks. With a smooth, powerful thrust, Sarah drove the needle directly into the dying man's chest. A sharp, audible hiss of trapped air, released loud enough to be heard even over the storm. Instantly, Davies took a massive, ragged gasp of air. The cyanosis, the deadly blue tint on his face, began to rapidly recede. "He's stable for transport. Move the litter," Sarah shouted. Together, Sarah Brooks and a trembling Harrison grabbed the handles of the litter. They pulled the patient out of the helicopter, ducking low to avoid the deadly arc of the main rotor blade. As soon as they cleared the blast zone, Sarah turned and gave Captain Reynolds a sharp, upward thrust of her fist. Clear to lift. The Black Hawk immediately banked hard, lifting off the helipad and disappearing back into the black, bruised clouds. They rushed the litter into the elevator. As the doors sealed them inside, shutting out the deafening roar of the storm, the silence was overwhelming. Harrison leaned against the metal wall, sliding down, slightly completely out of breath, his scrubs soaked in rain and blood. He looked over at Sarah. She was already calmly taking Davies's pulse, her face a mask of total serenity, checking the IV line the medic had started. She hadn't broken a single sweat. When the elevator doors opened to the ER, the trauma team was waiting. "Padan, let's go," Harrison shouted, his voice, cracking the adrenaline finally catching up to him. They wheeled Davies into the brightly lit room. A team of surgeons, led by Dr. Thomas Wright, the chief of surgery, immediately swarmed the bed. Needle decompression performed on the roof. Harrison reported, his voice shaky as he stripped off his wet gloves. "Vitals are stabilizing. V-fib averted. He needs a surgical chest tube and a full sweep for internal bleeding. Good call, Harrison," Dr. Wright said, taking a scalpel. That needle saved his life. Harrison looked across the room. He opened his mouth to say that he hadn't done it, that the slow nurse had executed a flawless combat medical procedure in a hurricane. But when he looked around, Sarah was already stepping back. She walked quietly out of Trauma Bay 1, took off her wet, high-visibility harness, wiped her safety goggles with a sterile towel, and placed them neatly back in the disaster locker. Then, without a word, she walked over to the nursing station, pulled out a stack of flow sheets, and began to chart the patient's intake. Jessica Miller stood by the desk, her mouth slightly open, staring at Sarah as if she were a ghost. 30 minutes later, the storm outside began to break. The frantic pace of the ER settled into a dull roar as the burn victims were stabilized and moved to the ICU. Davies was out of surgery and recovering. The automatic doors of the ambulance bay slid open. A towering figure walked in dripping wet. It was a man in a military flight suit, his helmet tucked under his arm. The name tape on his chest read, Reynolds. Captain David Reynolds had grounded his Black Hawk at a nearby municipal airport once the storm front passed, and had taken a squad car back to St. Jude's to check on his patient. He walked up to the charge nurse's desk. "I'm looking for the patient we dropped on the roof." "Davies. He's in the surgical ICU, Captain Doctor," Harrison said, stepping out of a break room with a cup of coffee. He looked at the pilot with immense respect. That was incredible flying up there. "I've never seen anything like it." Reynolds nodded curtly. "I had good ground control. If your team hadn't talked me in and secured that drop zone, we would have crashed. I need to speak to the woman who was on the radio." Harrison cleared his throat. feeling a deep, uncomfortable knot of shame forming in his stomach. That was Nurse Jenkins. She's over there. Harrison pointed toward Bay 4. Sarah was slowly, meticulously untangling a knot in an IV line for an elderly patient, speaking to him in a soft, soothing voice. Reynolds turned. When he saw the grey-haired woman with the tight bun, his rigid posture instantly shifted. He didn't walk over to her like a pilot greeting a civilian nurse. He marched over with the stiff, formal gait of a soldier, approaching a superior officer. He stopped 2 feet behind her, snapped his heels together, and stood at strict attention. "Commander Jenkins, Captain Reynolds," said his voice, echoing clearly across the quieted ER. Sarah finished taping the IV line. She turned around slowly, looking at the pilot. A faint, tired smile touched the corners of her mouth. "At ease, Captain Reynolds," Sarah said softly. "I haven't held that rank in 5 years. You did good work today. Your pitch control was excellent." Reynolds let out a breathless laugh, shaking his head. "I knew it was you on the comms, Ma'am. Nobody else has that voice. I thought you retired after the Helmand province extraction." Harrison, who had followed Reynolds over, couldn't hold back anymore. "Wait. Helmand province commander." He looked at Sarah, then at the pilot. "I'm sorry, but who exactly is she?" Reynolds turned to look at the arrogant young doctor, his eyes narrowing slightly. He looked around the ER, noticing the way Jessica and the other nurses were staring at Sarah with a mix of confusion and lingering disdain. "You people don't know?" Reynolds asked, genuinely shocked. He pointed a thumb at Sarah. "This is Commander Sarah Jenkins, United States Navy. For 8 years, she was the head surgical nurse for the Forward Resuscitative Surgical System, attached directly to Joint Special Operations Command." A heavy silence fell over the emergency room. Jessica Miller dropped a chart onto the desk. It hit the floor with a loud slap, but she didn't move to pick it up. She ran the trauma tents in Afghanistan, Syria, and Iraq. Reynolds continued, his voice ringing with absolute reverence. "We called her the Ice Queen. In a mass casualty situation, when mortars were dropping and people were screaming, she was the only one who never rushed. She used to tell the combat medics, 'Slow is smooth, and smooth is fast.' Rushing gets people killed. Rushing makes you drop a scalpel, or miss a torn artery, or push the wrong med." Reynolds looked directly at Harrison. During a compound raid in Helmand, an IED went off. 30 casualties in 1 hour. Commander Jenkins took shrapnel to her left shoulder and kept operating for 14 hours straight. She didn't lose a single man. She retired with a Silver Star and a Purple Heart. The only reason she moves the way she does is because she has spent her entire life walking through literal fire, and she knows that panic is the enemy of precision. Harrison felt the blood drain from his face. He remembered screaming at her for checking an expiration date on a vial. He remembered mocking her economy of motion, calling her a liability filing complaints because she refused to join his frantic, chaotic pace. He hadn't been witnessing incompetence. He had been witnessing the highest tier of tactical medical mastery. He was a civilian doctor playing God in a sterile room. She was a titan who had pulled soldiers back from the brink of death in the dirt and the dark. "Jenkins." Sarah Harrison whispered, his voice trembling with a profound, crushing humiliation. I am so profoundly sorry." Sarah looked at Harrison. There was no anger in her eyes, no vindication, and no gloating. She simply looked at him with the calm, steady gaze of a teacher who had just watched a student finally understand a difficult lesson. "Apology accepted, Dr. Harrison," Sarah said quietly. "But we have a waiting room full of lower acuity lacerations from the storm debris." If you're finished, I suggest we get back to work. She turned back to her medical cart. She picked up a fresh roll of gauze, checked the packaging, and began to walk slowly, deliberately, and smoothly toward the next patient. Behind her, the emergency room watched her go, the silence absolute. They would never call her Snail Sarah again. True heroes don't always wear capes. Sometimes they wear faded scrubs and move with the deliberate precision of a combat veteran. Sarah's story proves that competence isn't measured by frantic speed, but by remaining calm when the world shatters. If this real-life medical drama gave you chills, please hit that like button, share this video with your friends, and subscribe to our channel for more incredible stories.